Standard operating procedure to contain spread of COVID-19 in hotels and hospitality units. Hotels in containment zones to remain closed. Slide 1. Following arrangements to be ensured. Point 1. Mandatory provision of sanitizer dispenser and thermal screening at the entrance. Point 2. Only asymptomatic staff and guests to be allowed. Point 3. Mandatory use of face cover by all staff and guests and to be worn at all times inside the hotel. Point 4. Adequate manpower to be deployed for ensuring social distancing norms. Point 5. Staff to wear gloves and take the required precautionary measures. Slide 2.1. All employees with higher risk, that is older person, pregnant women and employees with medical conditions to take extra care or precautions. They should not be exposed to frontline work requiring direct contact with the public. Hotel management to facilitate work from home wherever feasible. Point 2. Proper crowd management in the hotel and in outside premises like parking lots during following social distancing norms to be ensured. Point 3. Large gatherings to remain prohibited. Slide 3. Point 1. Valet parking to be operational with operative staff wearing face masks and gloves. Proper disinfection of steering, door handles, keys, etc. of vehicle to be ensured. Point 2. Separate entry and exits for guests, staff and goods or supplies to be arranged. Point 3. Physical distancing of a minimum of 6 feet to be maintained while queuing up. Point 4. Specific markings to be made with sufficient distance to manage the queue and ensure social distancing in the premises. Slide 4. Point 1. Number of people in the elevator to be restricted, duly maintaining social distancing norms. Point 2. Use of escalators with one person on alternate steps to be encouraged. Point 3. For AC or ventilation, guidelines of CPWD to be followed. All AC devices to be 24 to 30 degrees Celsius. Relative humidity to be 40 to 70%. Intake of fresh air to be as much as possible with adequate cross ventilation. Point 4. Guests to provide their details like travel history, medical condition, etc. along with their ID and self-declaration form at the reception. Slide 5. Point 1. Prominent display, posters, standees, audio-video media on preventive measures about COVID-19. Point 2. Hand sanitizer must be kept at the reception for guests. Guests to sanitize hands before and after filling relevant forms. Point 3. Hotels to adopt contactless processes like QR code, online forms, digital payments for both check-in and check-out. Point 4. Luggage to be disinfected before sending it to the rooms. Point 5. Guests with higher risk, that is, those who are older, pregnant, or those with medical conditions, advised to take extra precautions. Slide 6. Point 1. Guests should be advised not to visit containment zones. Point 2. Required precautions while handling supplies, inventories, and goods, and proper queue management and disinfection to be ensured. Point 3. Appropriate personal protection gears like face mask, gloves, hand sanitizer, etc. to be made available for staff and guests. Point 4. Room service or takeaways to be encouraged instead of dine-in. Delivery staff to leave food packet at guest or customer's door. Point 5. Thermal screening of home delivery staff prior to allowing them for deliveries. Slide 7. Point 1. For room service, communication between guests and in-house staff to be through intercom or mobile phone, and room service to be provided while maintaining adequate social distance. Point 2. Gaming, arcades or children play area to remain closed. Point 3. Frequent sanitation within the premises to be maintained with particular focus on lavatories, drinking and hand washing stations. Point 4. Cleaning and regular disinfection using 1% sodium hypochlorite of frequently touched surfaces like doorknobs, elevator buttons, handrails, etc. Mandatory in all guest service areas and common areas. Slide 8. Point 1. Proper disposal of leftover face covers, masks, gloves to be ensured. Point 2. Deep cleaning of all washrooms to be ensured at regular intervals. Point 3. Rooms and other service area to be sanitized each time a guest leaves. Point 4. Kitchen staff to follow social distancing norms and kitchens to be sanitized at regular intervals. Slide 9. Detailed guidelines issued for restaurants to be followed. Point 1. Sitting arrangement in the restaurant to be made ensuring adequate social distancing. Point 2. Disposable menus are advised to be used. Point 3. Use of good quality disposable paper napkins to be encouraged. Point 4. contactless mode of ordering and digital mode of payment to be encouraged. Point 5. Buffet service to follow social distancing norms among guests. Slide 10. Measures to be taken on occurrence of case. Point 1. Place the ill person in a room or area where they are isolated from others. Point 2. Provide a mask or face cover till such time he/she is examined by a doctor. Point 3. Immediately inform the nearest medical facility or call the state or district helpline. Point 4. A risk assessment will be undertaken by the designated public health authority and accordingly further action be initiated regarding management of case, his or her contacts and need for disinfection. Point 5. Disinfection of the premises to be taken up if the person is found positive.